viewers, today we have with us Dr. Meera Ragavan, a super specialist in urogynecology, and she is an academic as well. She is an MRCOG, member of Royal College of Obstetric and Gynecologist. So today I had the opportunity to interview her on various topics which are prevalent in my own demographic. I hail from Bangladesh, so I'm planning to develop a full-fledged healthcare for our women demography, uh, for all age groups comprising from the age of 15 adolescent to post 60 or old age, whatever. So I'll be talking on issues which are most prevalent in our place, and Dr. Meera will help us to enlighten and lay down policies, that is roles and responsibilities on part of the public, general public, the patient, and the doctors over there, including herself, that what we should do, when we must do it, and how to do it. The strategy and tactics will be laid down by Dr. Meera. Hi, Dr. Meera. How are
Hello.
you?
Good morning.
How are you doing?
I'm absolutely fine. Hope you're doing well.
Are we all set to go?
Yes,
Okay.
definitely.
The thing is that first I would like to, on the spectrum of disease and conditions, I would like to start with the most dangerous thing, that is cancer related to female reproductive system. So we'll be covering cervical cancer and breast cancer for the time being. Then we'll be talking on two conditions such as fibroid and PCOS.
Sure.
So which fibroids and PCOS are the conditions which affect female lifestyle, and it can be with slightest of modification they can have a rewarding lifestyle.
Very true.
So today I would like you to talk on as a lifestyle coach
Definitely.
and as a doctor as well, so the balance.
More of a preventative role.
Exactly. So let us start with cervical cancer.
Sure.
So what is cervical cancer?
Now, cervical cancer is a cancerous growth in the neck of the womb, which happens, and it can affect any age group, but primarily in the West it used to affect women above 60. But younger women can also be subjected to the risk of cervical cancer.
Okay.
This is a very deadly cancer in the sense, if detected earlier, in the precancerous stage or in the early stage 1-2, we can effect a cure and prolong the survival of the woman being cancer free for more than 10, 15 or even 20 years. However, if you miss the boat and plan and happen to detect the cancer at a much more later stage, like stage 3, the survival significantly declines to less than 50% in stage 3 and less than 30% in stage 4. So at the end of the day, our aim is to reduce the death rate or the mortality due to cervical cancer, which has happened very well in the West.
Okay.
Having said that, the demographics of the South Asian continent is significantly predisposed to this particular cancer due to certain cultural practices and the use of tobacco in various forms, early onset of sexual intercourse because of the early age of marriage, to some extent multiple sexual partners, unsafe sexual practices, and the use of tobacco, especially smoking in certain women tribes and polygamy in certain tribes, predisposing themselves to the risk of cervical cancer. So I think it's very relevant in the context of the Asian subcontinent to discuss this, because it's a matter of improving the immunity whereby we can prevent these cancers.
And how do you explain the causes in the context of urban middle class? So what are the practices, or what are the habits, what are the behavioral patterns that these urban middle class display which leads them to this sort of a cancer? Can you explain
Definitely.
it?
Now, the thing is, we discussed that it is definitely a cancer which is related to certain aspects of lifestyle or vices during their lifestyle, especially predisposing them to the risk of a viral infection called a human papilloma virus. This is kind of a precursor virus which infects the cells in the neck of the womb, and if the body doesn't fight with immunity, these viruses cause changes in the cells of the neck of the womb, making them become malignant in the long run. So, prevention of viral exposure or boosting up the ways in which the body rejects the virus related changes and prevents malignant transformation would be our key step to either prevent the cancer or contain it so that it doesn't become cancer from a precancerous stage. So, what are the lifestyle measures or identifying at-risk population? Unsafe sexual practices, not using condoms for sexual intercourse, or use of tobacco in any form, especially smoking, reduces the immunity, prevents the host mechanism which will fight against the virus, thereby predisposing them to cancerous stages. So people are all aware of the fact that smoking causes oral cancers, gastric cancers, but many people do not know smoking is a very important risk factor for bladder cancer and cervical cancer. If somebody has a precancerous lesion in the cervix and I tell them stop smoking, that itself goes a long way in prevention of that precancer becoming cancer. So, as far as the urban millennial youth are concerned, safe sexual practices have to be overemphasized repetitively to prevent their exposure to the virus, which is the causative agent for the cancer, and also smoking cessation or abstaining from tobacco use of any form.
And doctor, one more thing in relation, that is how malnutrition contributes to the whole scenario. Since we are used to foods that are high on energy but low on nutrition,
Definitely.
so like how it contributes the whole scenario to the whole scenario.
Cervical cancer is not very much linked to nutrition. However, usage of fruits and vegetables, which are good in antioxidants, mainly vitamin C and E, prevents the malignant changes and the viral responses to the host cells, and thereby can prevent the progression of a precancer to a cancer. But however, there is no direct link between diet, like what happens for bowel or breast cancer, directly linked to cervical cancer.
Okay. And doctor, like, what is the prevention policy that you would like to suggest to our viewers who are seeing the symptoms or who at least have identified or became worried with the symptoms? What are those early symptoms, red flag symptoms? What is the policy they would like to lay it down to them?
Okay. Now let us look at it from a three-point view. Say the patient or the woman herself, the local healthcare provider, and a specialist, because each one owns the responsibility to address their health issues so that they can ensure well-being. So what are the warning symptoms I need to educate the woman about so she picks up for herself and is self-aware that this is not something right and I need to approach a local healthcare provider? Any bleeding of any form immediately after intercourse, a white discharge which is persistent for more than 2 weeks.
That is before marriage or after marriage?
Anytime for that matter. More so after a sexual intercourse. Blood-stained discharge. Bleeding on and off which does not follow the pattern of menstrual irregularity. Bleeding between periods. Any kind of postmenopausal bleeding. These are definite warning symptoms which should immediately raise a red flag in the woman's mind so that she seeks immediate local health care provider assessment. This is not something to be ignored and this is not something to be sat upon because a simple test like a speculum examination, taking cells which are dead cells from the neck of the womb and to be seen under the microscope will help us detect early cancer. In fact, in the field where the tribes are and where there is a risk of cervical cancer in plenty, just by doing a simple speculum examination in the field or training the village health workers and the nurses there to do a speculum examination, we have managed to do what is called downstaging of cervical cancer. Say, for example, if the woman did not have the access to a healthcare facility, nobody saw her but she still had the red flag symptoms, she would have detected herself at stage 4 and would not have had the survival benefit. But if we train the local village health workers or the nurses, they would just need to do a speculum examination and what would have been otherwise left up to stage 4 could have been picked up at stage 2 and we prolong the survival of 5 years by 50%.
So getting delayed is denied.
Yes. So red flag symptom warning should be educated, and women should be aware that these are the symptoms and signs. They should approach their local healthcare provider. And how do we train the local healthcare provider is to immediately give weightage for these symptoms and perform a simple speculum examination, and if possible do a pap smear. Now these are easily usable kits, they are very much available, they're cost effective, and people can get trained even online to do these things. And we do what we call telehealth screening of cervical cancer, where the woman is in a remote place and the speculum examination is done by the village health nurse, and we apply a particular chemical called acetic acid. So we do a visual inspection with acetic acid called BIA, and this particular protein, the acid, degenerates the protein which is there because of the malignant cells. And we can see abnormal patterns on the neck of the womb through the telehealth camera. And we sitting here from a farthest place in the Himalayas, we will be able to visualize whether that cervix is abnormal or normal. That itself is a good enough screening process, and further testing can be immediately done. If that is negative, the woman is reassured. If it's positive, the woman is then escalated to the nearby advanced health center where a pap smear can be done and subsequent biopsy can be undertaken. So these are the ways in which the community health worker can help.
Yeah.
So that leads on to the various ways we screen for cervical cancer.
And like you have explained the self-evident symptoms, then the clinical diagnosis. So what is left? Like you have made it so easy how to go for the screening and what are the tests she is expecting, how it can be done from a remote healthcare by a remote healthcare system, and consequent counseling and all. So like now, what is the policy? What would be the policy for the one who has already advanced to a stage that is very critical? That is when one needs a surgical intervention. Okay. Please enlighten on.
See, if a woman comes, as already referred to us, what we need to do is basic biopsy or pap smear, whichever, depending on the stage of the situation, and that will prove the diagnosis of cervical cancer. We do imaging in the form of MRI to find out whether the cervix alone is affected, whether this cancer is contained to the cervix, or whether it is spread to the contiguous areas and tissues. So depending upon that, we do MRI staging of the condition, and stage 1 and 2A can be easily dealt with by surgical measures. The surgery is what we call Wertheim's hysterectomy, which involves removal of the womb, the neck of the womb, and a part of the vaginal area, along with the parametrial tissue and the nodes as well, depending on what is involved. And it's a radical procedure. Nowadays, we can do with keyhole as well.
Okay.
Stage 2B and 3 and 4 are kind of advanced stages which do not lend themselves well to surgical therapy, but we have excellent advances in radiation therapy, and women who have undergone this kind of radiation, we see the survivors 20 years down the lane now. So they can be having the advantage of this particular modality of treatment and prolong the survival. So we have both surgical measures as well as radiotherapy measures.
Okay.
But there is one unfortunate subset of women who are young, who still not have had a pregnancy and would be affected by the early cervical cancer and would like to retain fertility for further future. So in that case, if we had to do a hysterectomy, that would obviously negate the chance of them for future childbearing. With the recent advances, we have something called a trachelectomy, which is an advanced procedure where the affected portion of the cervix alone is taken out without compromising the chances of cure for that particular problem. So the woman is given the chance that she could have future childbearing. This is something which is a technical advancement in the field of cervical cancer and has to be thought about in women wanting to retain fertility for future childbearing, especially if the woman is young.
And tell us on the super specialist interventions performed by you to your center.
The most important thing we would like to do is First, from educational awareness point of view, we give a lot of educational material as to what the warning symptoms are, who should have testing done, and so on and so forth. In this context, I would like to emphasize on two important things. One is cervical screening, other one is the cervical cancer vaccine. The cervical screening is done by a simple test with a speculum. It's a gentle examination whereby we take off the scraping of the dead cells from the neck of the womb and do what is called a pap smear. This is a very simple test, the result of it which will be available in 48 to 72 hours, and we will know whether there is infection, whether there is any abnormality, suggestion of early cancer or an invasive cancer. Depending on that report, we can then carry out further testing. If this flags up any abnormality, this person can be subjected to a procedure called colposcopy. Now, colposcopy is nothing but a magnification of the problem in the cervix with certain special lighted filters. So we get a zoomed up picture where we can apply certain chemicals which will pick up the abnormal areas in the cervix, and targeted biopsy or treatment of those lesions can be carried out. Once we get the biopsy, we see whether we are in concurrence with what the pap smear said or whether we have a higher grade of abnormality in the cervical region. Depending on that, then we decide whether this patient has got a cancer or not. And once the cancer is established, we do the MRI imaging for the staging and carry out the appropriate procedures as to whether it is a surgical intervention or a radiotherapy. This is how the process of right from screening takes on to the treatment, and the whole spectrum of treatment is taken care of. Who should have pap smear? Ideally, all women beyond the age of 21 should have pap smear, and it should be carried out till the age of 65, irrespective of whether they are menopausal or not. And women should have it every 3 years. Nowadays, beyond the age of 30, I have combined in our clinic human papillomavirus testing as well, because it makes sense, as that is the causative agent for the cervical cancer. If HPV is negative, they can have the pap smear done every 5 years, not every 3 years. The HPV comes back positive, then I need to find out whether it has already caused any damage in the cervical cells. So I know all women will be exposed to this virus at some stage in their lifetime, but there is a way to prevent the damage done by those viruses to the host cells. So how do we do it? That leads us on to the cervical cancer vaccine, which is the latest advancement which has happened over the last decade, and it's a very promising way by which we can prevent our future generation from being subjected to the risk of cervical cancer. WHO has included it in the vaccination schedule and in the Western countries, but we don't have it in the developing countries as yet. Now, this cervical cancer preferably is given in the early adolescent and teenage group, even before their risk of exposure to sexual health is happening. So anytime after 13 years, preferably within 26 years, it's given as 3 doses at 0 months, 2 months and 6 months. It does not need a booster, and it offers more than 98% protection against cervical cancer. But for the time being, we do say that even if you're vaccinated, it is important that you undergo pap smear later on at an appropriate age as per the schedule. So this offers a double protection for the prevention of cervical cancer.
Doctor, you being a robotic surgeon, enlighten us on 2 things. That is what is the advantage of robotic surgery in this scenario? The other thing is how robotic surgery can be made something of a lifestyle corrective surgery, because it's so easy for the patient, so bearable for the patient. Is it so?
Not all patients are amenable to robotic surgery. As far as stage 1 or 2A cervical cancer is concerned, if the tumor bulk is less than 4 centimeters, they can undergo the Wertheim hysterectomy, keyhole-wise, and robotic surgery can be performed. It does not compromise on the cure rate for the cervical cancer, and the lesser post-operative stay, lesser pain after the surgery, lesser post-operative complications, warrant robotic surgery as an option which should be discussed with these patients so they get better very soon rather than an open operation. So definitely robotic as a technique definitely has a stay in the treatment of early cervical cancers, but not all patients might be suitable to undergo this particular technique.
Thank you, doctor. Thank you.